radiomics. Okay, so I've split it into two. So it is a radiological. So radiological images form the basis for this. Omics is a suffix when we use when we have large data with us, like genomics, right? Because there's a lot of hundreds and thousands of genes and permutations and mutations and a lot of things. So omics is like a kind of suffix which we use when we have a very large data. The very concept of radiomics is what is the quantitative analysis which we can do on these images. Okay. Till now, the human eye was seeing images, right? And this is also going to be a short class because I'm not going to go into very much details because then we'll forget the whole thing and we won't be able to write any answers. So the human eye usually will assess the images and then we'll try to interpret them and then integrate it with other knowledges and then give a diagnosis, right? That is how we have been doing image interpretation in radiology, right? But radiomics is about quantitative analysis of whatever data is there in an image, right? People who have some background of photography or image analysis know that every image will have some pixels. Speaking about images in layman terms, whenever we talk about radiology, we know that the smallest part of the image will be the voxel, right? So we have to see what a voxel can offer and how do we see these images, because we mostly have shades of gray. So we have some varying colors in there, right? Also remember that it can be done for any modality. Most commonly it's being done for PET-CT, CT and MR. It's very hard for MR because, as we all know, we never rely a lot on the signal intensity quantification in MR, right? We don't do that. We don't draw an ROI and we see how it is, is it brighter or is it less? We don't do that in MR. So MR is the harder of these modalities, right, to be used in radiomics. So remember, it is more than what the eye can see. Okay. Better than what we can see, more of a quantitative outlook. Where has it been used a lot? So over the decades, I think it began with a couple of publications, and then now the count is in thousands or 5,000s every year. This is the number of publications which are happening in radiomics. So it's really picking up, especially in the background of machine learning. So what happens is, why are we trying to do this? See, for example, we are seeing this image, right? This we all know, this is a bladder mass. Okay, this is the urinary bladder, and this is the mass, right? So we've already described it in our report, right? This is an enhancing mass. It is along this wall. This is the shape. This is the volume. This is the enhancement pattern. But now what we have done, we are trying to see whether within this mass there are different areas. Okay. So for example, here what has been done using certain mathematical features like entropy or homogeneity, right? We use the word heterogeneous and homogeneous, right? So what does homogeneous mean? Homogeneous means that everything is like uniform. It's very similar to each other. Whatever is here is also there. But heterogeneous is more like, this is how it is. So this is homogeneous and this is heterogeneous. So, whenever there is some kind of heterogeneous nature of tumors, we all know that we don't actually see homogeneous tumors, right? We see very heterogeneous tumors, and in fact, we use it like a surrogate for aggressive tumors. Here, what we have done, we have quantified this heterogeneity. If you notice, you can see that it is higher in these regions, right? And so this is more homogeneous part and this is the heterogeneous part, right? So you can see that what we were trying to see by this, we'll have to change a lot of windows, settings, center and width levels to actually see कि it's heterogeneous or homogeneous, right? It doesn't look so bad. But when we are using mathematics to make a map or to show it in a different way, like in a color coded map, we can very well see that this part and this part are similar. This is different. This is what heterogeneous means. Okay. So in cancer, what happens? We have to find out tumor heterogeneity, right? Tumor, so there is a big mass, it has a heterogeneous attenuation, and a characteristics are all heterogeneous. So the cells in this region are going to be different from this one, right? Based on how different these cells are within one mass, we have to understand that this can actually help us predict the biology of the tumor, right? Just like histology, we try to see the cells, that's just an example, but here you can also understand that this heterogeneity can help us in diagnosing, right, or in prognosticating, in response to treatment or follow up. Imagine I have this tumor. This is a map which I have drawn first based on the quantification. Suppose after treatment, this changes, right? So we can actually work up and research whether this change is actually a good thing or whether it's correlating with survival, right? So this is a next step in assessing whatever the image can give us, right? Next thing which I have come across is that sometimes it's been postulated that it can help us choose the right site for sampling, resection, biopsy, right? Suppose I want to know, where should I take a sample from? So we all want to avoid necrotic areas. We all want very high cellular, areas so that we can get the right cells. Sometimes it's not even that simple. Sometimes you want that these cells which have a different genetic makeup and expression in their tumor suppressor genes or in their activator genes, we want to target those particular cells. So this heterogeneity which is projecting like this in images is also at a cellular level, right? So this becomes our biomarker. Biomarker is anything which can help us understand the cellular pathophysiology, right? So this will become like an imaging biomarker. This heterogeneity can tell us like what is actually going on within these cells. And maybe if we try to correlate with the biopsy samples or cytology or genetic outputs, we can tell that this heterogeneous part was corresponding to that. Or maybe X tumor shows this kind of heterogeneity, and that's why whenever it shows this, it can have this percentage of prognosis, right? So you can actually kind of detect, prognosticate, a lot of things. So this is the basic outlook, that it's mathematical, it's quantitative analysis, its utility at the moment is highest in oncology. This is the example which you can work around, right? You can tell that it can help you to choose the tissue. It can help you to diagnose the tumor, prognosticate it, you see the response and you see the follow-up. This also creates imaging biomarkers, right? It helps us to understand the cell and the cellular pathophysiology in this region. So I have put in very limited flowcharts, very limited words, because our main purpose is to understand the concept and write an answer around it. Because these are things which are very mathematical and sometimes related to coding, machine learning. So it can be hard to understand without background. So we will do basic things. Okay. So first of all, let's just broadly look at it, how it works. So first we image the patients that we are doing, right? We have images for the patient. Then we are going to draw the region of interest. Okay. So now this can be in a 2D or it can be in a 3D, volume of interest, region of interest, VOI, ROI. Okay. So we can see it in respect to the entire organ, or we can further micro dissect it, like, we find different areas here. So we are again kind of marking these areas, right? And then you can render it in 3D to give you a better idea, right? and quantitative features are extracted. So what does this mean? Feature is something which you got out of this numeric data. Okay. Feature is something that you, just like when we see an image, we pick up some points in favor and against the disease, we extract features out of this. Then we would want that our image based features, if we can actually club them with clinical and with genetic, then we can have a model. So what is a model? I will introduce this word here only because we'll be using it in the subsequent slides. Nothing fancy. Think of it like a mathematical function which helps us to decide what is next, right? A lot of times you'll know na, machine learning models, AI models, what do these do? Either they will try to classify, right? They can have basic functions. Suppose, basic classification task will be whether this is a diseased image or not diseased image. So you are classifying it. Okay. Next, you can predict, right? So these models, suppose I give it some data, can it predict something? I tell him that these are two groups of students. One of them, I will give them a data of like 50 students here and 50 students here. And all of these are always, at the head of their class, and these are such, and they have this one habit, each of them. So then the model interprets it, and whenever I will provide it with a new sample, it will tell me whether it's going to lead the class or it's not going to lead the class. So it can predict on the new data, right? So you can predict, you can classify, right? So classification can have multiple ways. It can tell us the diagnosis of the patient, right? I can ask it to classify whether it's a lung CA or it's TB. Then it can help us diagnose, right? Then I can ask it to classify whether this patient is going to improve or not improve, so it can prognosticate. So models need some kind of features, just like our mind needs some features in the images. So this is AI, right? Model making. So artificial intelligence is basically you're creating algorithms, right? So many a times there are certain networks which can see the data on their own, right? These we will try to understand this further also, because you will have many questions. I am very sure about it. Just like so AI has multiple components. Artificial intelligence is something which tries to be like us. So we also work in a logical manner. We choose some features and then decide, okay, these features are more common in this disease, hence we go with this diagnosis. Similarly, based on the features and the data we give the model, it will be trained. It will learn just like a child learns in a school. And then he's going to make some predictions, some classifications on the new data that you give, like an exam, right? So models are a crucial part of artificial intelligence. Improving the models, making them more independent when they don't need our supervision. That's how we can go into machine learning, deep learning, that's how it works. So this is a part of a part of this, right? So we start with this, right? So that's how the quantitative features are going to help us, because just by extracting the features, it's not going to be of any help, right? It doesn't help me if I say that this particular value is higher in this region. It doesn't help me, right? Unless I apply it. So the next thing is that, again, any kind of tumorous soft tissue or abnormal pathology will not be homogeneous, will not be uniform, right? Also, sometimes we have to identify habitats, right? People say, right, homing, and the cells, tumor cells, they home into particular metastatic sites. So within tumor, heterogeneity, and within the body also, right? Where do I biopsy from the metastatic side, from the original side? Does it make a difference? That's what's the questions radiomics is trying to answer, right? Now suppose I talked about features, right? Something which is going to help us understand. So I found this a little easy so that we can kind of think in our mind. So there is something called a semantic feature, something which we always write in our radiology reports. What is the size of the tumor, shape of the tumor, location, vascularity, speculations, necrosis, right? We always write this in our reports. What we don't do is maths, right? So these are the mathematical functions, which we are trying to get out of this image. So this will include histogram analysis, right? Then you can get some texture analysis, and these are just names. Remember, we cannot just understand everything easily, right? So these are just some mathematical functions, right, which are much more complex. Okay. These are complex and they try to fit the image into a pattern, right? So it's trying to understand the image, right? So these are the various mathematical ways in which we can do it. So these are all things which human mind is trying to do with math, right? You can also let deep learning algorithms do it. Like suppose I just give images to this deep learning model, right? A deep learning algorithm. It's just going to see hundreds of images and then it is going to choose something on its own, right? Something that it has found may be common, may be uncommon within these images. It's going to make a pattern recognition in that. So there can be handcrafted features like traditional ones, like the ones we are mentioning here, right? Because these are all math and statistical features, right? Stats we do. And so these are all statistical. The next is deep learning. Deep learning is when you leave these images into the system, into a deep learning algorithm, and then it will kind of try to find out a pattern on its own without our supervision. The only limitation there is that we don't know how it picks it up. I'll give you a very quick example of this. We probably cannot cover everything about machine learning, but a very good example which I have understood is, suppose I ask a model to pick up when is it a dog and when is it a wolf, right? The model started performing very well. It was very accurate. It picked up wolf and dog really well from all the images available on the internet. But there was a big problem. It was not related to the fact that it's either a dog or a wolf. It was related to snow in the background. All wolves usually have snow in the background. So it was actually focusing on the snow pattern, that whenever an image has snow, it's a wolf. So that's a feature. It helped it to predict well, but it was not the right thing to do. We tell a difference between a wolf and a dog based on the animal itself.